Is HRT safe? So this is a great question. I know lots of women worry about the risk of HRT, or they may have come across some things in the media, social media, about the potential risk of HRT. When you have a discussion with a clinician, what we do is firstly risk stratify you. And what this means is we work out certain things by asking you questions that would lead to any potential risks. So things like previous cancers, a family history of blood clots, if you have any heart conditions, and this will help determine what is the appropriate HRT for you. So what this could mean is that if you, for instance, have a risk factor, you may be offered just a progesterone component as opposed to estrogen and the progesterone, as often it's the estrogen that can increase your risk of certain aspects regarding your health. The most important thing is the clinician will go through your risks with you, what your risks are, and how likely they are to occur if you were to go on HRT. What a lot of women have reported is that the benefit that they've gained from HRT far outweighs any of the risks that they could have been exposed to, and the quality of life, their well-being mentally and physically is so much greater being on HRT that they wouldn't even look back at not being on HRT. In fact, women are advocates for HRT and often will want to share their experiences in groups, and we have some local groups here near us in Hyde that do a fantastic job of doing that too. HRT isn't the only treatment option available for menopause. There are other options available too, depending on your symptoms. So for instance, if you suffer mostly from hot flushes and that's the main symptom that's causing distress, lack of sleep and frustration, then you may be offered another medication like, for instance, sertraline. Now sertraline is traditionally used as an antidepressant. However, we found that women who have hot flushes and menopause, when given sertraline, the number of hot flushes or the intensity of hot flushes decreases significantly. And this could be beneficial because it allows you to focus and treat on just the main symptoms that you're experiencing. There are other forms of treatment also available in menopause that depend on your symptoms. So I would encourage you to have a chat with your clinician, understand what's best for you and how to manage your specific symptoms.